Good morning, wherever you are. This is Miles Carter from ConferenceHype. Our segment will focus on radiation-induced volume changes in the parotid and submandibular glands, intragland dose distribution, and quality of life scores over a long follow-up period. From the 2026 August edition of Advances in Radiation Oncology. Background: locally advanced soft tissue sarcomas cause significant tumor mass effects, often leading to onerous symptoms. Methods: our institution has previously developed partially ablative body radiation therapy for palliation in these circumstances, which has demonstrated effective symptom relief. Results: the median age was 73 years and 56 years in the PABR and SBR groups, respectively. Discussion: PABR for bulky unresectable sarcomas may provide improved palliation of symptoms compared to SBR, with potentially better local control despite treating significantly larger tumors. From the 2026 August edition of Advances in Radiation Oncology. Background: consensus guidelines from IBS-GEC ESTRO-IBS, Indian Brachytherapy Society Group, European Decuriotherapy, European Society for Radiotherapy and Oncology, American Brachytherapy Society. For computed tomography-based contouring, have recently introduced possibilities of CT-based adaptive brachytherapy for cervical cancer. Methods: the present study attempts to validate the guidelines by using magnetic resonance imaging at diagnosis and in a pre-BT environment. Results: 208 scans from 104 sets of 52 patients of CT and magnetic resonance scans were the basis for this study. Discussion: despite the dimensional differences, there was no dosimetric difference in HRCTV and IRCTV. From the 2026 August edition of Advances in Radiation Oncology. Background: adjuvant radiation therapy planning for mucosal head and neck squamous cell carcinoma is challenging due to postoperative anatomic changes, contributing to variability in clinical target volume delineation and risk of geographic miss or unnecessary dose expansion. Methods: patient-specific three-dimensional specimen maps may offer a novel approach to improve the localization of high-risk margins and facilitate multidisciplinary communication. Results: 13 patients were treated by 5 radiation oncologists. Discussion: integration of patient-specific 3D specimen maps into adjuvant radiation therapy planning for head and neck squamous cell carcinoma is feasible and can meaningfully influence target delineation, particularly for boost volumes. From the 2026 August edition of Advances in Radiation Oncology. Background: integration of radiation oncology content into the educational offerings of other cancer specialty societies may improve the use of radiation therapy in guidelines-concordant care. Methods: however, minimal data describes the extent to which this occurs. Results: a total of 20% of education sessions included an RO speaker or moderator, comprising 6% of 1419 total speakers. Discussion: radiation oncologists are uncommon speakers at ASCO annual meeting sessions and have low and declining rates of involvement in planning committees. From the 2026 August edition of Advances in Radiation Oncology. Background: dysgeusia is a common toxicity experienced by patients with head and neck cancer receiving radiation therapy. Methods: in this study, we assess the timescale of onset, progression, and recovery of dysgeusia using an objective measure. Results: of the 50 patients who underwent baseline taste testing, 32 completed 12-week post-RT follow-up assessments. Discussion: this study confirms significant alterations in taste perception in patients with HNC during after RT. From the 2026 August edition of Advances in Radiation Oncology. Background: spatially fractionated radiation therapy is a promising treatment involving the delivery of discrete spheres of high-dose radiation, potentially enhancing treatment response. Methods: despite encouraging results for adult patients, no SFRT data exist in pediatric patients. Results: 5 pediatric patients who received SFRT were identified, with a median age of 15.7 years. Discussion: we present one of the first case series of SFRT in pediatric patients, with favorable local control and toxicity results. From the 2026 August edition of Advances in Radiation Oncology. Background: pencil beam scanning proton beam therapy is highly sensitive to anatomic variations, often necessitating adaptive replanning to ensure accurate dose delivery. Methods and materials: we retrospectively analyzed 300 consecutive patients treated with robustly optimized PBS-BBT. Results of 761 QACTs performed, 541 were PQACT and 220 were TQACT. Discussion: PBS-BBT frequently necessitates ARP. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August edition of Advances in Radiation Oncology. Background: there are limited prospective data to guide the management of patients with cutaneous squamous cell carcinoma presenting with locally advanced, unresectable disease. Methods: previously, we conducted a prospective pilot study of chemoradiation for patients with unresectable CSCC. Results: 15 patients were enrolled between May 2019 and June 2021. Discussion: to our knowledge, this is the only prospective series of chemoradiation in combination with checkpoint inhibitor immunotherapy for unresectable CSCC. From the 2026 August edition of Advances in Radiation Oncology. Background: failure mode and effects analysis is widely used in radiation oncology to proactively identify and mitigate risks, but it is time-consuming and depends heavily on expert experience. Methods: this study evaluated whether large language models can supplement traditional expert-driven FMEA by identifying novel failure modes within the radiation planning assistant workflow. Results: the 4 LLMs collectively generated 190 candidate failure modes. Discussion: LLMs can broaden risk discovery in FMEA by surfacing contextually relevant and previously unrecognized failure modes. From the 2026 August edition of Advances in Radiation Oncology. Background: to develop and validate a protocol-agnostic machine learning platform for knowledge-based planning in external beam radiation therapy. Methods and materials: 5,334 retrospective photon beam treatment plans from 2 institutions were used to develop and internally test general-purpose models for organ at-risk dose-volume histogram prediction. Results: in the plan comparison study, there were no or-dose metrics for which PPs were statistically significantly greater than clinical plans. Discussion: predictive planning represents a shift in KBP from protocol-specific models trained with small, uniform data sets to protocol-agnostic, disease site-specific models trained with large, heterogeneous data sets. From the 2026 August edition of Advances in Radiation Oncology. Background: retractions in the scientific literature undermine research integrity and can have lasting effects on clinical and academic practices. Methods: The aim of this systematic review was to analyze retracted publications in the recent radiation oncology literature and to identify trends in study characteristics, reasons for retraction, and post-retraction citation patterns. Results: a total of 108 retracted studies were identified and analyzed. Discussion: this study found that retractions in radiation oncology remain generally rather rare events. That's it for now for ConferenceHype's coverage of the August 2026 issue of Advances in Radiation Oncology. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.